We've kind of been on social media this week, spreading the word that every week should be mental health or mental wellness week. As you know, it's not something that goes away. If you're struggling, it can be there at any time. So I think normalizing the conversation around mental health is one of our main priorities. Is that we want people to know that it's always a good time to talk about it, not just during campaigns. But yeah, we just started last September in providing mental health navigation and support to young people in particular in Muskoka. And it's been amazing. We didn't know if it would fly. We didn't know if our service would be used, but we've helped over 150 young people since we started last September and formed incredible partnerships with other service providers. So yeah, we're thrilled to be able to help in this regard.
Jody, this is a topic that is near and dear to my heart, having dealt with my own mental health issues. And I've really discovered that this is a conversation that doesn't happen as often as it should, and it still isn't recognized in a way that it should be in terms of an actual illness for people are dealing with. What is your perspective on this? How far have we come, and how much further do we need to go with this conversation?
I think that we've figured out how to start talking about mental health. There's lots of campaigns that are, open up, talk about it, share it, bring it to the surface. And I think that's the beginning. But I think there is still a great deal of stigma. I know it's the number one reason why young people don't reach out for help, because there is stigma. And I think as long as we aren't viewing mental health in the same way we're viewing physical health, there's going to continue to be stigma. So I think the mindset has to change. I mean, I don't know of people who have diabetes who are being shamed or being told to, buck up, or it's not that bad, or get over it. I mean, when someone has a diagnosable physical condition, we give them all the respect and space and kindness and support they deserve in whatever way they're needing that help. But when it comes to mental health, we don't have the same openness and understanding, and we don't support people the same way, which is that's got to change.
It's funny that you mentioned these stigmas, because I recently did a post where I was talking about how when years ago, people would tell me things like you need to grow thicker skin and things like that. And that is such a toxic thing to say to somebody, in this world now. And I think people haven't realized that, you're stigmatizing without even realizing it by saying things, because, the term grow thicker skin means that you aren't able to deal with something emotionally, and there's something wrong with that. But that in itself is the wrong mindset, right?
Absolutely. I mean, we don't blame people who have a physical illness ever. We don't say, oh, come on, you must be weak if you have diabetes. We understand that there's a biological component to illness when it comes to that type. But I think it's tricky for people, because mental illness can have a biological component that's diagnosable and treatable or manageable, but mental health can also have a situational component. And I think that's where we get caught, is that we don't realize that our mental health is affected by every component of our life. So you can have a predisposition or a genetic part of you that is related to your mental health, but then what's going on around you, or what's happened to you, your past traumatic experiences, all of those things also feed into mental health, and they're less measurable. I mean, when you're looking at a human being and they're limping, they're injured. But when you're looking at a human being and they've grown up in a traumatic environment or they've been abused, you can't see that. So it's so much harder for us to understand that it's legitimate. So we don't validate people when they say they're struggling, because we can't see a reason why they would be. And I think we need to trust that when people are sharing something so personal and vulnerable, that they're telling us the truth, and we need to validate. That's number one, validate. Stop doubting people when they're sharing that with you. It's hard enough to share that, especially with all the stigma attached.
Jody, let's talk about the major component here. How much has the COVID-19 pandemic pushed the conversation forward on mental health awareness?
I think it's definitely pushed it to a breaking point. I mean, overall, before the pandemic, people were struggling. We were, under-supported for mental health, for sure. The waiting times are ridiculous for people. I mean, if you come forward and you say you're in a bad situation mentally, and then you're told that you can get some counseling, but in 8 months, that's not the way things should be. And that's how it was before the pandemic. So then you add all the pressures that come with a pandemic, the isolation piece, and, increase in depression and anxiety and the unsure future and financial strain and relationship strain. All those situational things are going to worsen anything that already existed and even cause people to develop mental health because of those pressures. So it's definitely bubbled those things to the surface. They were bad already, so it's only worse now. I mean, in the folks that we're seeing, the 150 young people and their parents that we've been talking to, none of them have come to us to say, I'm reaching out because of COVID, but there's definitely a worsening effect. Anyone who was struggling is struggling more, and it's harder. So it's hopefully, one good thing that will come out of COVID is that it has pushed it to a tipping point, and people are now waking up and realizing this is a real thing. I just really hope that when we recover from the pandemic and life gets back to whatever our new normal is going to be, that we don't forget how critical this is. And we don't put it on the back burner. It needs to be addressed. These waiting times and lack of services, it's inexcusable. We don't have that sort of strain in our physical health care. It shouldn't be that way for mental health. And a lot of the care that people are looking for comes with a price tag attached. So people just simply don't get the help they need because long-term trauma counseling costs money. It's not free. So I think a lot of things have to change. Hopefully that will be a silver lining of this.
I agree with you. I hope so as well. We could talk about this all day, but we do need to cut it short. But what I will do is give you an opportunity just again to tell me about what MiND-AID is offering and how people can start their own conversation about mental health.
For sure. Well, we're here to help people who aren't sure where to start. So if you're struggling and you know that you're not getting back to your normal self and things are getting, hard, you're not functioning right in life, you're not being productive, your social circles are breaking down and you need help, we're a first place to reach out to. And we do help people under the age of 30 and parents and guardians of those young people too. But if you're over 30, we're not going to turn you away. We'll point you in the right direction of an organization that can support you too. So we're great for that first step of figuring out what to do next. We're also great for explaining terminology and processes, what's funded, what's not, what requires a diagnosis, which doesn't, where do you get that? So all of the confusing pieces and moving parts of the mental health system, we can explain that to people too. We're free, and you can contact us through the website, over the phone, email, any way you want, and we'd be happy to help you out for as long as needed. And then the other message that I have too is that for those that are out there that want to support mental health, MiND-AID is new and our pilot period was amazing. We are now looking for long-term funding to keep this going. So we could use that help as well. So if you are in a good place mentally and you want to help, then perhaps supporting an organization locally that is supporting people with mental health is a good way for you to contribute.